Do you know the silent signs of diabetes? Or perhaps you know someone who's been diagnosed with it, but you're unsure about what it really means? Well, it's time to shed some light on this prevalent health issue. Diabetes, put simply, is a condition where there's an excess of sugar in the blood. This sugar, or glucose, is what our bodies typically convert into energy. However, in the case of diabetes, the body isn't able to manage this glucose effectively, leading to high blood sugar levels. Now, there are different types of diabetes, each with its distinct characteristics. The most common is type 2 diabetes, where the body either resists the effects of insulin, a hormone that regulates the movement of sugar into the cells, or doesn't produce enough insulin to maintain a normal glucose level. Then there's type 1 diabetes, a more severe form where the body's immune system attacks and destroys insulin-producing cells in the pancreas. This type is often diagnosed in children and young adults, hence it's sometimes called juvenile diabetes. Gestational diabetes is another type that occurs during pregnancy. Although it usually goes away after childbirth, it does increase the mother's risk of developing type 2 diabetes later in life. Knowing the symptoms of diabetes can help in early detection and treatment. Common symptoms include frequent urination, excessive thirst, unexplained weight loss, extreme fatigue, blurred vision, and slow healing sores. In children and infants, symptoms might also include fruity-smelling breath, belly pain, and a sudden increase in appetite. So, how can we manage diabetes? Well, a healthy lifestyle is key. Regular exercise, a balanced diet, and maintaining a healthy weight all play crucial roles in managing this condition. For type 1 diabetes, insulin therapy is the primary treatment. This involves injecting insulin several times a day or wearing an insulin pump. On the other hand, managing type 2 diabetes often involves lifestyle changes and sometimes medication or insulin therapy. And what about prevention? While there's no surefire way to prevent type 1 diabetes, type 2 diabetes prevention is achievable. Again, the key lies in maintaining a healthy lifestyle. Regular physical activity, a healthy diet, maintaining a normal body weight, and avoiding tobacco use can significantly reduce your risk. In summary, diabetes is a condition characterized by high blood sugar levels, with different types including type 1, type 2, and gestational diabetes. Symptoms can vary, but often include frequent urination, excessive thirst, and unexplained weight loss. Treatment and management strategies primarily involve lifestyle changes, medication, and in some cases, insulin therapy. Prevention, particularly for type 2 diabetes, hinges on maintaining a healthy lifestyle. Remember, diabetes may be a lifelong condition, but it doesn't have to define your life. With the right knowledge and tools, you can successfully manage it and lead a healthy, fulfilling life.
Chances are high that you've crossed paths with someone living with diabetes, or perhaps it's a condition that's all too familiar within your own family. But have you ever stopped to wonder what really causes diabetes? How does this illness find its way into the lives of so many? Diabetes essentially comes in two forms, type 1 and type 2, each with its own origin story and method of treatment. Type 1 diabetes is a bit of a rogue, often showing up uninvited due to a malfunctioning pancreas. The reasons for this malfunction vary greatly, ranging from a person's immune system turning against their own pancreas to the destruction of the pancreas due to an injury or surgery. This type of diabetes can strike at any age but is commonly diagnosed in children and young adults, hence its alternate name, juvenile diabetes. On the other hand, type 2 diabetes is a little less random. While there may be some hereditary elements at play, it's often linked to lifestyle choices. This form of diabetes arises when the body becomes resistant to the insulin that the pancreas is still producing, or when the pancreas just can't keep up with the demand for insulin. So what triggers these conditions? Well, for type 1 diabetes, it could be an autoimmune disorder where the body's defense system attacks the pancreas. There might also be some other form of damage to the pancreas that's not necessarily tied to age. Type 2 diabetes, however, may be triggered by unhealthy sugar-rich diets and a lack of physical activity. When the pancreas is constantly battling to regulate high blood sugar levels, it can become exhausted. Other potential triggers include high blood pressure and chronic stress. Though not directly proven as causes, individuals with high blood pressure or prolonged unmanaged stress are more likely to develop diabetes. In summary, the causes of diabetes are as varied as the individuals who live with this condition. Type 1 diabetes often stems from a malfunctioning pancreas, potentially due to an autoimmune disorder or physical damage. Type 2 diabetes, on the other hand, is linked to insulin resistance and inadequate insulin production, often influenced by lifestyle choices. Understanding these causes is a crucial step towards awareness and prevention.
Ever found yourself wondering about the differences between type 1 and type 2 diabetes? Or perhaps you've been puzzled about the existence of other types of diabetes, or even diseases that mimic this condition. Well, it's time to unravel these mysteries and shed light on the myriad forms of diabetes. First, let's delve into type 1 diabetes. Often referred to as juvenile onset diabetes, it typically affects people under the age of 25. The pancreas, in most cases due to an autoimmune issue, becomes incapacitated and ceases to produce insulin. This form of diabetes tends to run in families and will persist throughout the individual's life, necessitating insulin and possibly other medications. Next up is type 2 diabetes, which usually presents itself later in life. Its symptoms echo those of type 1, such as excessive thirst, unexplained weight loss, frequent urination, fatigue, and a tingling sensation in the extremities. However, type 2 often can be managed with a balanced diet and regular exercise, especially if detected early. Type 2 diabetics usually have a functioning pancreas, but it either doesn't produce sufficient insulin or the insulin it does produce isn't processed or recognized by the body, a condition known as insulin resistance. Now let's turn to a lesser-known variant, diabetes insipidus. Despite sharing the same moniker and a few symptoms with diabetes mellitus, such as frequent urination and excessive thirst, diabetes insipidus is fundamentally distinct. It's primarily a kidney disease, often linked to the pituitary gland, which produces two hormones, one stimulating the kidneys to produce more urine, and the other inhibiting urine production. In the case of diabetes insipidus, the kidneys either cease to respond to these hormones, or the pituitary gland malfunctions, leading to improper secretion of these hormones. Lastly, let's examine MODY, or maturity onset diabetes of the young. This type is often mistaken for type 1 or 2 diabetes, but it's different, sometimes even referred to as type 1.5. It arises from a single mutated gene that can be passed from parent to child. MODY exhibits varying degrees of severity, with MODY 1 and 3 sometimes necessitating insulin, occasionally in oral form only, while MODY 2 doesn't require any form of insulin. Understanding the differences between these types of diabetes is key to managing them effectively. Remember, knowledge is power, and in this case, it could be a lifesaver.
How prevalent is diabetes really? The answer might surprise you. Estimates reveal that between 25 to 26 million people in the United States live with this condition, and it's not just a concern for older, overweight individuals. Infants, children, and adults alike can all experience the effects of this disease. So, let's delve into the signs and symptoms of diabetes across different age groups. We start with infants. Detecting diabetes in this age group can be challenging. It's crucial to watch out for signs of both high and low blood sugar. Infants with low blood sugar may tremble, appear cranky, or display pale or blue lips and fingers. On the other hand, high blood sugar could present as dehydration, excessive drinking, and frequent urination. A sweetish smell to the urine is another telltale sign. Other symptoms include excessive sleepiness, extreme hunger, slow-healing sores, and a dark velvety rash on the back of the neck. Moving on to children, the signs of diabetes can be similar to those in infants. Extreme thirst, frequent urination, and unexplained weight loss despite ravenous hunger are key signs. Other symptoms include mood swings, irritability, fatigue, uncharacteristic behavior, vision problems, chronic yeast infections, and tingling in hands and feet. Lastly, we have adults. While both type 1 and type 2 diabetes can occur in adulthood, their symptoms are often alike. Unexplained weight loss, excessive thirst and urination, and tingling in the extremities are all potential indicators. It's important to remember that unexplained weight loss isn't always a good sign, especially if it's accompanied by other symptoms. In summary, diabetes can affect anyone, regardless of age. The signs and symptoms vary, but often include unexplained weight loss, excessive thirst and urination, and tingling in the hands and feet. Infants and children may also show additional symptoms such as mood changes, unusual behavior, and slow healing sores. However, remember that other disorders can mimic the symptoms of diabetes, including liver disease, morbid obesity, and the side effects of certain medications. So if you notice these symptoms, it's best to consult a doctor for an accurate diagnosis. Understanding the signs and symptoms of diabetes in different age groups is crucial to early detection and effective treatment. So stay informed and proactive about your health.
Did you know there are various treatment options for diabetes? Indeed, the world of medical science is a dynamic one, always evolving, always seeking better, more effective solutions. And in the realm of diabetes, this is no different. Innovations are constantly emerging, offering hope and improvement for those living with this condition. One of the most well-known treatments for diabetes, particularly type 1, is insulin. This can be administered in a number of ways. For some, it's a shot, self-administered daily. For others, it's an insulin pump, an external device attached by a small tube that produces the necessary insulin based on the user's input. For those with type 2 diabetes, the need for insulin varies. If necessary, options range from inhaled or oral insulin to traditional shots or pens. Beyond insulin, other medications are often part of a diabetic's treatment plan. Medications like metformin work by reducing the glucose produced by the liver, which in turn aids the body's response to insulin. Others, such as glipizide and glimepiride, bolster the pancreas's own insulin production. Then, there are the DPP-4 inhibitors, a newer class of medication that stimulates insulin secretion and reduces the secretion of glucagon, a hormone that raises blood sugar levels. But there's more than just traditional medicine on the table. A host of natural substances have been identified for their potential to lower or stabilize blood sugar. Chromium, a mineral found in whole sugarcane, is one such substance. Others include stevia, magnesium, essential fatty acids, cinnamon, and ginseng. Acupuncture too has been considered as a potential alternative treatment for diabetes. And while it might not seem like a treatment per se, diet and exercise are crucial aspects of managing diabetes. They might not involve drugs or conventional therapy, but they play an essential role in regulating blood sugar and maintaining a healthy body weight. In summary, the treatment options for diabetes are numerous and diverse, ranging from insulin and medications to alternative treatments and lifestyle changes. The key is finding a treatment plan that works best for you under the guidance of your healthcare provider. After all, diabetes might be a part of your life, but it doesn't have to define it.
Our first tip centers around the importance of a proper diet. Prioritize plant-based foods. Fruits, vegetables, and legumes should form the core of your meals. Incorporate magnesium-rich foods like black beans, spinach, and almonds into your diet to help stabilize blood sugar levels. Don't forget to include onions and garlic, which are natural blood sugar regulators. And for those with a sweet tooth, consider using stevia, a calorie-free sweetener that can help lower blood sugar levels. Next up, never underestimate the power of exercise. Regular physical activity can lower blood sugar levels and help maintain a healthy weight. Strive for at least 30 minutes of exercise most days of the week, combining aerobic and strength training exercises for maximum benefits. Stress management is another crucial element in preventing diabetes. Techniques such as meditation, deep breathing exercises, or yoga can help manage stress levels and reduce the risk of developing this condition. Blood pressure management is equally essential. High blood pressure and diabetes often go hand in hand, and lifestyle modifications like a healthy diet and regular exercise can help manage both conditions simultaneously. Reducing your intake of high fructose corn syrup, or HFCS, can significantly reduce your risk of developing diabetes. Opt for whole, unprocessed foods whenever possible to limit your HFCS intake. Avoiding saturated and trans fats is another key step. These unhealthy fats, often found in processed foods and certain meats, can exacerbate diabetes symptoms. Our final tip is about managing diabetes with diet and exercise. Choose the right carbohydrates, emphasizing whole fruits and grains over refined sugars and grains. Combine proteins with carbohydrates to help prevent blood sugar spikes. Include healthy fats like those found in fish, avocados, and nuts in moderation, while avoiding saturated and trans fats. Regular exercise can help manage blood sugar levels and maintain a healthy weight. In summary, proper diet, regular exercise, stress management, blood pressure management, reducing HFCS intake, avoiding unhealthy fats, and smart food combinations can all play a significant role in preventing diabetes. Remember, everyone is unique, and what works best for you might not work as well for others. Always consult a healthcare professional for personalized advice and guidance tailored to your individual needs. By implementing these lifestyle changes, you can take a proactive approach to your health and significantly reduce your risk of developing diabetes.
Do you know how to recognize and prevent complications of diabetes? This knowledge can be a lifesaver, especially if diabetes has been silently affecting someone you know, or even yourself. Prevention is always the best cure. Here are a few steps to prevent complications from diabetes. First, if you smoke, consider quitting. Smoking constricts blood vessels, exacerbates circulation issues, and increases the risk of cardiovascular disease and vision problems. Secondly, always take prescribed medication as directed. Self-medication can lead to serious complications, so any changes to your medication should be made under professional guidance. Thirdly, never underestimate the value of regular checkups. Regular physicals and specific checkups for your diabetes, particularly your vision, can help prevent complications down the line. Lastly, maintaining a healthy weight through a balanced diet and regular exercise can help manage diabetes and prevent complications. Now let's talk about recognizing complications. Diabetes can affect many parts of the body, including the eyes, kidneys, nerves, heart, blood vessels, gums, and feet. Neuropathy, or nerve damage, can exhibit symptoms such as burning, tingling sensations in the hands and feet, sharp nighttime pain, and difficulty walking. Swollen red feet are also a sign of serious nerve complications. Vision problems such as blurry vision, sudden loss of vision, flashing lights or grey, drifting films across your eyes may indicate diabetic vision complications. Pain and pressure in the eye are also symptoms. Kidney complications may manifest as fatigue, poor concentration, painful urination, and/or edema in the abdomen, around the eyes or in the ankles and feet. High and low blood sugar levels also need immediate attention. Symptoms of very low blood sugar may include nausea, extreme fatigue, confusion, emotional imbalance, and ravenous hunger. High blood sugar may cause excessive thirst, headache, and increased frequent urination. In conclusion, prevention of diabetes complications involves a healthy lifestyle, regular checkups, and diligent medication management. Recognition requires vigilance for symptoms, particularly in areas most affected by diabetes. Remember, early recognition and prevention can be key to managing diabetes effectively.